What is detoxing from speed or meth like? Well, in this video, you'll hear from clinical program director Danielle DeBoer as she explains the process a body goes through when it's coming down from speed, meth, or any type of upper. Hey, it's Clint with Sandstone Care, where we help teens, young adults, and their families overcome challenges that come with substance use, addiction, and mental health conditions. All right, let's get right to it.
So detoxing off of meth is interesting in a different way because actually when clients come here to detox from meth, insurance does not ever approve a true detox level of care. They do approve a residential or RTC level of care for detoxing from meth because alcohol is actually probably the most dangerous thing to detox from. If you don't detox appropriately, you have a seizure, and that's clearly life-threatening. And so much more of a medical concern there. Detoxing from meth, if you think someone's been up for days, part of their detox is crashing, sleeping, can't get up. Even they can say, I'll drink coffee and I try to get up and I just crash. And for days, they just want to sleep and their body kind of needs to catch up, but even the term catch up is not really appropriate. You can't really catch up on sleep. We could do a whole another thing on sleep. But the detox experience is partially a lot of sleep, but then partially just monitoring what's going on with the heart rate. And as the body is starting to come down, what's the next thing that's popping up? Is there severe anxiety or depression? Are there some, like you alluded to, the beliefs about, oh my goodness, I need to get back to work. I need to be productive. I need to go do something. I need to go. Often as soon as someone starts feeling a little better, they have this sudden urgency that, oh, I think I'm good. I need to go. I need to go. And there's a lot of struggle with staying and engaging and completing the full detox and residential. So detox is seen as purely medical and residential is seen as half medical and half therapeutic. And when someone comes into detox from meth, they are immediately put into the residential level of care. So we are constantly encouraging them to engage in the therapy. But there's the struggle with the body circadian rhythm being completely thrown off. I completely relate to the coffee example though, because I have that. Like if I have one thing that is so hard for me to give up, it's coffee. And you know, if you stop drinking coffee, then there's headaches and there's, like you said, excuses. Well, I'll do this tomorrow. Oh, well, this won't hurt too bad. No one's gonna get a DUI from too much coffee. Okay, that's true. And there are other consequences.
Yeah, and I think it's important for us to look at things in this light because we tend to think about addiction as something that can never happen to us if we've never been addicted to something. But when we equate it to something that we do feel this kind of pull from, that we don't feel like we can perform as well or live without, then suddenly it becomes a little bit more relatable, right? Like, and coffee as a whole is something like that. Like you think about t-shirts and fashion that say, but first coffee, or don't talk before coffee, right? That is the sign of a dependence, right? That is a clear sign of you thinking that you can't do something without a substance, right? And when anybody's addicted to a substance, it's the same thing. And it can be for different reasons. You feel like you can't be as social at a party if you're not high, right? Or if you're not intoxicated. You feel like you're not going to perform as well at work. You feel like people are not going to like you as much. You feel like you cannot relax. You know, I have a friend and he smokes marijuana and he says, I can't eat unless I've smoked. And I'm like, man, that's a pretty significant thing, right? Like you can't eat unless you've smoked. It's, you know, so we all have these things and it becomes this progressive thing that spirals more and more until you realize that you feel like you can't do anything until you've had this drug. And then it feels like a job.
Yeah, there's, like you said, there's the norm of using it socially, but there's also, I mean, I have a cup of coffee right here. Holding a warm cup of coffee is like this comforting experience, right? I think it kind of speaks to some kind of deep thing in us that is comforted by that warm cup of coffee, and that it's more than just the caffeine. The caffeine in itself is a pretty powerful stimulant and it's addictive. But holding something that's comforting and warm is also pretty powerful. And so there's that part of it. Just like anybody who uses a substance, it's not just the effect of the substance. There's something about the ritual in using the substance. And everyone has their preferred way to use, you know. So like meth is sometimes used by smoking it, sometimes intravenously, and smoking gets the fastest high. Smoking something, nicotine, meth, whatever, you inhale that and in 7 seconds it hits your brain. So it's just this fast, intense euphoria. Putting it in your intravenously has a longer lasting high, but whatever somebody's method, if someone is used to needles and they see a needle, that is like you and I driving past a coffee shop and smelling that coffee shop and like, oh man, that's tempting. That smells so good. Or someone else who's used to smoking it and they see a pipe laying somewhere, oh man, it just kind of puts them immediately in that craving place that we can relate to with coffee.
If you want to learn more about treatment options for you, your teen, or young adult, then tell us about your situation on a confidential call using the number linked up in the description box below, or live chat with us at sandstonecare.com. We'll connect you with the treatment that you need, and if we're not the right fit, we'll get you where you need to go. Be well, and remember that change is possible.